This is the starting of my greatest fear. I'm all packed up, getting out of here. But then you call and tell me not to go, that I'm the one who put the rock and roll in your life. This is the starting of a brand new day. I never liked this town much anyway. I need the city like I need the rain. Though that somewhere there's a northbound train. Oh, I'll make it without you. Make it without you. Though my body's leaky, it's my mouth that must be lying now. This is the starting of my far from grace. Self-esteem, oh, it's seen better days. You know I'll never let this go to waste. I'll keep this memory on the map I trace back to home. Friends.
The media places great emphasis on those who have had success with the treatment, but much less focus on patients who have negative outcomes, or, quite commonly, those who do not observe any change in their condition.
In some cases, patients come away from the procedure with an even greater loss of function than they initially had. The procedure itself has the potential to exacerbate symptoms, while at the same time accelerating the rate of others that otherwise might not have appeared until a much later stage of the disease.
Furthermore, the installation of a stent or a balloon in these narrow blood vessels comes with its own risks for complications. The installation of a balloon could increase the risk for intracranial hemorrhaging. There is a chance that the stent can dislodge itself and migrate into the heart, almost certainly causing death. There is also an increased risk for blood clot formation around the stent. Incidentally, prescribing blood thinners to prevent this further increases the risk for intracranial bleeding.
In addition to these complications, most people are unaware of certain limitations concerning liberation therapy. Research has shown that patients with the greatest positive outcome were those suffering from relapse-remitting MS, characterized by periods of disability with intermittent periods where symptoms disappear.
On another note, one could also question the validity of Dr. Zamboni's original study.
While a number of studies have been conducted since Dr. Zamboni's, none have been able to replicate the results he had obtained from his patients.
The major shortcoming of the study is that it is not a blinded study. There is a great possibility that bias could be playing an important role in trying to find hope for treatment of this chronic disease.
Doctors should be able to refuse treatment that they do not think is in the best interest of the patient, especially when there is so much inconclusive evidence surrounding it. There are other proven alternative therapies that are highly effective in helping relieve symptoms, yet they come at a much lower risk.
These therapies include massage therapy,
Beta interferon therapy,
corticosteroids,
and acupuncture.
To be clear, in no way are we belittling the pain MS patients suffer, nor are we denying their rights to make decisions regarding their own health.
However, Until further studies prove this therapy to be effective, liberation therapy should not be approved in Canada.
I just wanna